Hi everyone at the State Nurses Association conference on rural healthcare here in Colorado. So sorry I couldn't be there today. I'm scared away by the snow and I live a very long distance away, but I didn't want to keep from meeting with you and to get to share with you. So I would encourage you to contact me if you have questions or there's anything more you want to discuss, since I'm not able to do that with you today. My topic is how to survive in nursing school, and I'm going to add how to thrive in nursing school. So there's lots of books about this, and you can find lots of information on this. So what I'm going to do is just briefly mention those topics, and then I'm going to go on to the topic I really want to talk about. So, of course, time management is really important. Prioritizing and including time to take care of yourself. The reminder I would give you here is that for every hour that you're in class, you're supposed to be spending 2 hours of time in prep and study. And so that semester that has 15 hours, you've got at least 30 hours of study. So you have a full-time job just going to school, in nursing school. So let me just carry that over to the next topic, which I was able to work in nursing school, and some students are able to work in nursing school, be able to work in nursing school. So it's some it works well, others it doesn't. So I would just tell you to be prepared. And there's an excellent Kaplan webinar on complex, and one of the statistics they look at is what puts people at risk for. One of the big ones is anybody who works 16 to 20 hours while they're in nursing school, 16 per 20 hours per week, particularly at risk for failing NCLEX. And there's others that go along with that, but that is one of them. Also very important in nursing school. I have a whole entire video on that I'd encourage you to watch at my website, which is www.pocketprof.apps.com. Pocket Prof Apps. Video on testing skills. I'm not going to spend any time on that because you have both Kaplan and Hurst there at your conference to talk with you about that. The other thing I have a video on that I'm not going to spend much time on, but I think is really, really important, is identifying your and studying based on your learning style. I think we do a pretty good job in education of having students identify what their learning style is, but then I think we kind of stop there and we don't do such a great job of making sure you know what to do with that learning style and how should you change your study. They tend to study like everybody else does, and that works well, but then when you have a unique learning style, or maybe the typical way of just writing your notes and reading through them over and over and over again doesn't work for you, you become much more efficient if you study the best way for you. I have, a whole video on that at my website that you're welcome to. I do want to say about learning and studying. One thing I think is incredibly important, and which is not my favorite, I think it's important, it's just not my favorite. I would do a study on this. But students that prepare retain a lot more in class. And so what I tell students is, I get it to read the book, the whole chapter, or you're reading it, your is not your learning style is reading. That doesn't mean you shouldn't read. And it doesn't mean that your instructors can't test you on the reading assignments, even though they haven't covered it. They certainly can. But what it does mean is that if you prepare before you come in some way, you will retain more. So what I tell students is, at a minimum, read the key points from your chapter. So you can read them in your book, or if you have the Evolve website resources, they always have a section on key points for the chapter. And you can either print it. It's never more than 3 pages. Sometimes it's 1, most 3. And then you can also download an audio file if you're an audio learner. And you can listen to it in your car on the way to school. The key is this: read or listen to this before the lecture. What happens in your brain is that your brain has already thought about this material. Even if you didn't fully understand it, if you just read through it, by the time your instructor presents on it, your brain is now able to process, and it hears this additional things from your instructor. and you know if you have questions, things you can ask. If you're hearing the material for the very first time when your instructor presents it, you've not done any prep at all, your brain is not processing that material yet. It's hearing it and kind of going, whoa, and then later it kind of thinks through. But when your brain later thinks through that, we've already moved on to another topic. So I have seen incredible success with students who will prepare before class, and every one of you has time to read 3 pages before class. And if you have 3 chapters and 9 pages, every one of you has time to do that. So I would strongly encourage you, if you've never done that, to try it. The other thing I'd really encourage you with learning style and studying that I know is not on my video is taking notes. Even if your instructor gives you everything, they give you everything in writing, or you don't feel like you need to take notes, there is definitely value in handwriting notes. Now, some of you, it might be okay to type them on your laptop, but for a lot of people, the act of typing is not the same as handwriting it. So again, kind of experiment for you, but I would really recommend you take notes the old-fashioned way. Use your slides or use your PowerPoint notes or anything that the instructor gives you as something to go back and refer to later. But while they're lecturing, be actively engaged. Because if you're not an auditory learner, being actively engaged is the only way you're going to pick it up while they're talking. You've got to write things down, and it's just that additional way to cause that information to sink into your head. So I really, really recommend you take notes in some way, and detailed notes is what I would do. Let's see. A couple more things I want to talk about with learning style and studying things is NCLEX practice questions. Every single day. I tell students as soon as they hit foundations or fundamentals of nursing, whatever you call it at your school, start doing 5 NCLEX questions every day. And there's lots of apps out there that are free. You've got plenty of books. As you get into Med Surg 1 and 2 and OB and PEDS and all your specialties, do your NCLEX questions based on the subjects you're covering, and it's study time. When you start doing them in foundations, it's sometimes hard to find ones that are, at that level, that simple and that early in nursing school. So I'd do anything, because what you're practicing is critical thinking skills. And yes, you're not going to know a lot of stuff, but you're going to start reading those rationales because you know so little. And the learning in NCLEX practice questions comes by reading the rationales. So, for example, at our school, we require everyone to do NCLEX practice questions 25 a week in all our main classes, and you have to show proof of that. And the reason we require that is because we know that is one of the best ways to prepare for NCLEX and standardized tests. And that's where we all ultimately, that's all our ultimate goal, is for you to practice to pass NCLEX and to be a great nurse. So you got to pass NCLEX first to be a great nurse. So we're trying to help you do that, and we know that practicing that helps. So if you start doing it early before you have a lot of knowledge, you have to look at the rationales because you don't know enough. And then you learn that. Because what I find students do is they rush through those NCLEX questions because, I just have to get them done. And they're not really taking the opportunity to learn. And so several things you can do to make this a better exercise, again, is pick subjects you're working on until you get further in your curriculum, and then you need to do anything, random stuff. Also, read the rationales when you're done. What people tend to do is if you get the question right, you really don't read the rationale. You just glance, you go, yes, got it right, and you move on. But you may have guessed and got it right. So then you need to read the rationale and see why the other answers are wrong. The next step that would be more active learning would be for you to make sure you can say, before you ever look at those rationales, that you can give an explanation for why each answer is correct or incorrect. And then you read your rationale and see if you're correct. So that's the best way to use those NCLEX practice questions. Also, use your online resources. You have tons and tons and tons of those. So I'll talk about that more here in just a minute. A couple of other things. Seek help early. When you are struggling in a class, do not wait until it's potentially too late to get help from your instructor. Most of your instructors want to help you if you are actually seeking help. Where instructors get frustrated is when you are just fighting for a grade and you just want those extra 2 points, those extra 4 points, and you're not really wanting to learn. But when you want to learn and you really want help and you are willing to take the steps that it requires to help learn yourself, then instructors are usually more than willing to help you. And if they're not, then I'm going to tell you some ways to find your own resources. But seek help early, because if you wait until it's too late, it does a couple of things for instructors. For one, we're late in the semester, and we don't have as much time to help you. And it looks to us like you haven't really cared until now you're scared that you're not going to pass. And so it's a little bit harder for us to want to help you when you wait that long. So seek help early when you're struggling. Now, if you know you didn't study and that's your own fault, you don't need to get any help if you know what you did. But when you're not sure, then you need to seek some help. Last thing I'm going to say about studying for now is take advantage of everything that's offered to you. If they offer a test review and it's outside your class hours, go to it. Or if you can't go, ask somebody if they'll record it for you, as long as that's okay with your instructor. Take advantage of any tutors that are offered, because then you're hearing it from a different source, a different person, and sometimes it doesn't necessarily mean they're better at presentation. It means they presented it in a different way and it works for you. So take advantage of that, and then take advantage of any supplemental material. I can tell you that I offer incredible amounts of supplemental material in my MedSurg 1 and MedSurg 2 courses, but I don't think that many students take advantage of it. And it's stuff that I found as I'm preparing that I think will be helpful for people. So, take advantage, because if we've taken the time to find it for you and we think it was good enough to help somebody and nobody's using it, it kind of discourages from wanting to give you that material. Again, I can tell you for me, I put it out there because I know it's very helpful for lots of students. Now, the main thing that I really want to talk about is personal responsibility and accountability for your learning. I think as educators that we don't emphasize this enough, or we emphasize it in the wrong way. And so this is really where I want to spend my time. And I'm going to try to give you some real life examples. And then, again, feel free to contact me through my website and ask me any other questions or maybe specific things you'd like me to answer for you. I'm more than happy to do that. But what I mean about personal responsibility and accountability for your learning is, if you're very far in your nursing school career, you have realized that everything builds on previous courses. And you've realized that everything is tested on the NCLEX. And you've realized that if you didn't get something back in MedSurg 1, it's probably going to come back up again in MedSurg 2 and OB and PEDS and everywhere else. It's a huge difference in nursing school than it is in just your prerequisite college classes. In your prerequisite college classes, you can usually spit it and forget it. And meaning that you can cram, you can memorize, take your test and be done. And especially if you don't understand something, you can kind of get by and just get through on that test and be done with it, because you're not necessarily going to use that information again later. Now, a few classes build like that, but most in general you can do that. But in nursing school, it isn't like that at all. And that's one of the hardest things for students to understand when they first start. And that's why most students get very frustrated and angry and struggle in those first 2 or 3 quarters of nursing school. 2 or 3 semesters for most of you. And so the sooner you can realize this, the better. So honestly, I start talking about this way back in anatomy and physiology. When I have somebody come to me and say, hey, my friend wants to go to nursing school, do you have any advice? My advice is always, take your science classes seriously. Take A and P as I need to know this forever. And don't memorize it. Really, really try to learn it and make it ingrained in you so you understand it. Because that's the foundation for everything in nursing school. Now, most people don't ask me that because most people are already in nursing school when they ask this question, or they've already taken their A&P before they get there, and so it's a little late for that. But now they can realize it's important with all of their classes in nursing school, and they can start doing that now. So where this falls into accountability, personal responsibility and accountability is this. Is every instructor that you have in nursing school, are they all fantastic? I mean, really, we all know that's not true. We wish it was true, and I am over the faculty at my nursing school, and I wish all of them were fantastic, and most of them are, but some of them have struggles and development. The same thing is true in your nursing school. The same thing is true in your undergraduate college classes. Think about your prerequisites and the number of teachers you had that you called home and said, oh, my teacher is terrible. Well, you're going to have some of that in nursing school. But I just told you that if you don't learn that material, then you're going to struggle the next quarter because it's going to build on that material. So that means it's really important that you get the material. So you have to take some responsibility. Now, please don't hear me say something I'm not saying. I'm not saying that we can just give you any teacher, and if they're bad, too bad, good luck, that's your problem. That's not true. We have a responsibility to develop our faculty and to follow through on problems with our faculty. That means we have to know about it. So it means you ought to do your evaluations and be specific and talk to your faculty. But outside of all that, let's get rid of that for a minute. Let's talk about what you're going to do, because this is about how to survive and thrive in nursing school for you. So let's say you have an instructor that's not very good at presenting, and it's hard to be engaged in their class, and you don't feel like they talk about the things they're supposed to. What are you supposed to do? Well, again, here's where you need to take advantage of those online resources and supplemental material. There's so much out there. I don't have much on my website because I have limited time, but I have some things. You're welcome to go look there. Just go check out YouTube videos. Go look at Khan Academy. There are tons and tons of resources out there, and they're fantastic. And there are things that as an instructor I often use as supplemental material because I don't have time necessarily to show it in class, but it's a great way to explain things. So you have literally the world at your fingertips with your computer, and you can go find anything you need to give yourself help. And once you find some, it'll be much more easy to find other things. So take advantage of those resources. And certainly you should be doing that when you have a great instructor and you just have a concept that you don't really understand. Go do the same thing. I recommend starting with, if there's a concept you don't understand, I recommend starting with patient education sites like Mayo Clinic, PubMed, eMedicine. You need to make sure you're doing good ones, but those are good ones. And look at what the patient's being taught about that disease. Sometimes that's enough to just trigger you to understand. You kind of go, oh. Now, if you want deeper and you want patho, eMedicine for Physicians is a fantastic site. And let's say you do a search on heart failure, the first 12 will be patient education things. And you'll see eMedicine in there, you'll see Mayo Clinic. But after about 12, you'll see something like eMedicine in heart failure management and treatment. And you can tell that it's a little more cerebral, a little more intellectual site. And it's going to be a little above your head probably because it's very deep in patho, more medically based. But again, a great way for you to understand if that's your bent. So that's how I would suggest that you help with your own learning. Also, in terms of being accountable and responsible for your own learning, I oftentimes talk to students who have said, let's say they were a med-surg 1, and maybe they had a teacher that was kind of disinterested. And the teacher kind of checked out partway through and just started giving them answers to stuff. Well, at the time, as students, you think that is great. And you're like, sweet, we got the answers to the test, fantastic. Oh, they're letting us do this open book, yes. The problem is when you get that, it sounds great at the time, but it encourages you not to learn the information. And so you take the shortcut because, it's school, you're a student, you don't have a lot of time, you take that shortcut. But then what happens is it comes and catches up with you in MedSurg 2. So now you get a MedSurg 2 instructor like me, but like me, who expects that you learned all that stuff in MedSurg 1 as I'm supposed to expect. And now you didn't really learn it. And you say, oh, but we didn't have a good instructor, and they let us do take-home tests. And I say, I'm sorry, because you need to know that material. And I don't have time to reteach it. So here's some supplemental stuff, but you need to go back and review it. So at the time, it seems great. And nobody, guess what? No student ever complains about that. Students all complain if the teacher's too hard and mean or whatever. They never complain when the teacher lets them out early and giving them the answers until the next quarter when it catches up with them, or next semester. So please, please take responsibility. Know that you need to learn this. Know that this is a profession. This is a career. This is not just a college class. And it all builds. And NCLEX tests on everything. When I meet with brand new students that are just coming in for orientation to come into our program, I wheel in on a cart all the books they're going to buy during the course of their nursing school. And I tell them, NCLEX tests over everything in all these books. And you can't possibly memorize it. No matter how good you are, you can't memorize it. And even if you could, it tests critical thinking. So you have to apply it, memorized or not. So you've got to start from the beginning, ingraining this information, realizing this is what I've got to know to be a nurse. Now, does that mean that because I'm a nurse and I've been a nurse for 23 years that I know everything in those books? Absolutely not. But I've learned critical thinking, and I've learned where to find that information. The NCLEX has to test on your basic knowledge. And yes, you'll lose some of that as you specialize, just like I have. But you know where to find it, and you know at least the basics, and you know if it doesn't sound right, and that's where you've got to get. Let's see. Also, be a lifelong learner. We're all lifelong learners, and I hope all of your instructors are lifelong learners. I love it when my students say, well, I saw this in practice, and that's different than what you just said. Because our textbooks are already out of date as soon as they're published, because things change so quickly in medicine and in nursing. So I love it when they say that, because then I can look it up and see. And sometimes they're right, that's new, and sometimes they're wrong. It's old, and the people in practice are not doing it correctly. But be a learner that you want to learn forever and ever, and be engaged. It's not about the grades. I know those are important to you, but it's not about getting the best grade. It's about really knowing this stuff and ingraining it. I'd also remind you of things like being professional in your communication and following chain of command. These things are so important, not just because you're in school and not just because we have rules, but think about the profession we're preparing you for. We're preparing you for a true profession where your primary job is to be the patient advocate. And you're going to have to talk to people that you're afraid of, or people that aren't very nice to you, whether that's a doctor, or maybe it's your supervisor, or maybe it's a peer that you work with that's not very nice. And so nursing students a lot of times get frustrated by our rules in nursing school. Rules about you're tardy after 1 to 7 minutes, 49 seconds, and white shoes, and black pen, and people get really frustrated. Students get really frustrated with that. But this is all an effort to make you professionals and to understand you've got to be places on time. You've got to be early, actually. Those kind of things. Communication's so important. In your generation, grew up texting and grew up just doing short little things on your computer, and you've kind of lost that art of how to communicate with critical issues, and it's really important to learn that. So a lot of what we do in nursing school really is preparing you for some parts of that as a profession. All of this will help you as you talk to instructors. I've spent a lot of time recently with my students talking about chain of command. which is very important in your professional career, and you learn it in nursing school. If you have a problem in your class with your instructor and you feel like it really needs to be addressed, go to your instructor. If you're not confident enough to go to your instructor and very politely and professionally talk to them about your concerns, how do you feel like you can be confident talking to a physician that's yelling at you and you believe they need to do something different for the patient? Really, really important for you to learn. And it's not just because we're being mean as instructors or administrators. And that chain of command, also important as you move forward. Again, you can't go to the attending physician because you didn't like what the resident did. You have to go to the next person in the chain of command, the senior resident, or same thing on your nursing unit. You know, go straight to the director of nursing. You've got to go to your manager on your floor. And so the chain of command is really important for you to follow. Let's see, I have a couple more ones. So one more thing I'll just mention is, how do you respond to your peer group when someone in your peer group is running it for everybody else in your group? I mean, that seems to be a common theme that I see with nursing school. So again, this is part of learning to respond professionally, being willing to have those crucial conversations or those hard conversations in a very polite way, but firm way. So I would really encourage you to do that too. Again, I am more than happy to talk about all this stuff in detail with anyone. So send me an email through my website, reach out to me if you really want to talk about things, and I'm happy to do that. Thanks.